Hello, this is Dr. Ely. Welcome to ReadyRNs. Today we're going to look at the Nursing Tutor learning tool. Here you can type any nursing specialty. We're going to go for nephrology. And this tool will help you to learn what is typically seen in that specialty, as well as what nurses think about and what they're concerned about within that nursing specialty. In this case, nephrology nursing begins by saying, hey, do you want to describe a clinical scenario or do you want me to create one? And we'll have it create one. Please create a scenario. And then also it asks, do you want to have some hints? Do you want multiple choice options, or do you want to just free type your answer and have it give feedback on your answer? In this case, we'll go ahead and do multiple choice just to have a little help. Great, so we have a clinical scenario, and I can see that it's a 62-year-old male patient that we've been assigned, Mr. Thompson, been admitted for acute kidney injury, secondary to dehydration, and a recent use of NSAIDs. It provides vital signs, current lab results, patient history, including what allergies and medications they have, even a patient quote. It says, I've been feeling really tired and dizzy, and my legs seem to swell up now and then. In your assessment, you notice that Mr. Thompson has mild edema in his lower extremities, is complaining of lethargy, and seems anxious. You suspect that his current condition may worsen without appropriate nursing interventions. And down here, we have a decision point. What are we going to do? So if any of you have heard like Choose Your Own Adventure books, it's similar to that idea. As a nurse, we make a decision, and that leads the patient and ourselves to go down a certain road. And so that's essentially what this is set up as. As we make decisions, the scenario changes and adjusts based on what we've decided to do for the patient. And again, you have the option of free typing it, or you can use what's presented here as some hints, possibilities of what you could do. You don't even have to necessarily do these. So let's see what it says. Considering Mr. Thompson's vital signs and lab results, what will be your immediate nursing intervention? And so it gives lots of reasonable things. Some things may be crazy, but that's okay. It's supposed to help us to kind of think, what would we do? And actually, let's get some more help. Let's analyze these options. Let's say I'm brand new to nephrology. I have no idea what to do. So now we get to have a little help. And what it does is it takes each of those options and discusses the pros and cons of each. So you can see that. And then asks you, well, what do you think we should do? So let's just choose one. And let's actually go up and see. It looks like a pretty high potassium, semi-okay blood pressure. They are feeling tired and dizzy. Okay, so maybe we are concerned about that potassium. Maybe we are concerned about their heart. So high potassium can lead to potentially life-threatening cardiac arrhythmias. So if we're thinking about what's critical right now, I might be concerned about their heart. Let's go notify the physician about the potassium level and get an EKG. So now we're heading down this pathway, and let's see what happens. So upon notifying the physician, they appreciate your diligence in identifying the high potassium level of 5.5 and your concern for potential cardiac complications. The physician orders an EKG immediately, which reveals slight peak T waves, indicating mild hyperkalemia. The physician then prescribes Kayexalate to help reduce potassium levels and orders a repeat serum potassium level along with continued monitoring. So we continue, and then goes through and kind of updates you on what's going on. So we initiated cardiac monitoring, we administered the Kayexalate, and the patient expresses relief that his concerns were taken seriously, which decreases his anxiety. And you explain the EKG and help him out. So here's the decision point 2. Now with potassium and hydration issues addressed, it's important to ensure Mr. Thompson's overall management continues effectively. What will you do next? Administer the prescribed IV fluids to correct dehydration, assess the patient's vital signs and physical assessment more thoroughly, document the EKG findings, medication administration, and notifying the nursing team, educate the patient about the appointments importance of avoiding NSAIDs in the future. So you could ask for help to analyze what should we do. So I'm going to go C. All right. It says we promptly document the EKG. We administered the medication, keeps the nursing staff informed of the patient's status, and because it's kind of a critical time, that's probably why. And let's see, Mr. Thompson feels reassured knowing the team is attentive to his condition, thus reducing his anxiety. The collaborative approach enhances teamwork, supports optimal patient care. Mr. Thompson's potassium levels are monitored closely after administering the medication. You notice he is developing mild shortness of breath. What is your next step? So Mr. Thompson's lung sounds, respiratory effort immediately going through. So absolutely, we need to find out what's going on. So I'm going to go ahead and say A. On assessment, you find Mr. Thompson has bilateral crackles on oscillation and is using accessory muscles to breathe. His respiratory rate has increased to 24 breaths per minute and he appears slightly cyanotic around his lips. Not good. The assessment indicates possible pulmonary edema, which could be related to fluid overload or complications from his acute kidney injury. Mr. Thompson is deteriorating, requiring urgent intervention. Mr. Thompson expresses fear and concern about his breathing difficulty, adding emotional stress to his physical symptoms. You reassure him that you're taking immediate action to help alleviate his symptoms. In his deteriorating respiratory condition, what will you do next? So let's look. Administer oxygen via nasal cannula, notify the physician of the changes, position the patient in high Fowler's position to facilitate better breathing, document the findings, wait for the physician to evaluate, give a diuretic as per standing orders to help remove excess fluid. So I'm thinking we know that probably the fluid, but let's do something that we probably shouldn't do, which is focus on documentation. There's higher critical things, but let's just see what happens if we do something that might be lower on the priority list. After documenting Mr. Thompson's increased respiratory distress and lung sounds, you do not take immediate action beyond this. Unfortunately, this decision leads to delay in addressing his worsening condition. Mr. Thompson's shortness of breath continues to escalate and becomes more cyanotic. The nursing team notices he is struggling significantly and immediately starts assessing the situation. By the time the physician is notified, Mr. Thompson's oxygen saturation has dropped to 85%, indicating severe respiratory compromise. Mr. Thompson feels increasingly anxious and helpless as he struggles to breathe. Your documentation is thorough, but without immediate intervention, the patient needs to take precedence over paperwork. In this situation, an expert nurse would have taken the following steps. It describes a program comes to a point where it pauses and says, okay, so here's what an expert nurse would have done. And so we can learn from our decisions. There's no set number of decision points that it'll do. It just kind of is learning from or trying to decide when it's best to stop the situation, pause, and review what to do so you can learn. So as we see, it shows immediate assessment, oxygen administration, notify the physician, positioning, prepare diuretics. So you can see kind of that order of prioritizing as we do as nurses. It's very important to prioritize the care. And provides feedback on what we did well, what we could improve, and then asks if we'd like to continue this scenario and do more decision points, or if we want to try a new scenario altogether within nephrology. So we'll stop there, and we can actually just call this nephrology for now. Of course, we can add some tags if we wish, so we can find it later. Wonderful. So Mr. Thompson didn't turn out so well at the end, but hey, this is part of the safe space where we can learn, okay, what if I did that? What happens if I do that? And so it provides a safe place where we can explore our critical thinking and improve and get feedback. So I hope you enjoyed this and wish you happy practicing.